Bob and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob SCHRUPP, physical therapist.
Brad HEINECK, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
This video today was put together by Mike and Alex of the Bob and Brad crew. Both are physical therapist assistants and both have been providing treatments to our patients for years. They do
Fantastic work.
fantastic work.
We're very happy with all the work with their patients. We have reviewed and approved all of their material that they're bringing up. So they're showing you our treatment through them with their experience, and it's been
Exactly.
a wonderful.
So make sure you subscribe to the Bob and Brad crew channel, in which they do reviews of products that keep you healthy, fit, and pain-free. They handle all of our new products now. Enjoy the video.
Good luck.
Welcome, folks. I'm Alex, physical therapist assistant.
I'm Mike, physical therapist assistant.
And this is the Total Knee Replacement Fitness Program. And this is an exercise routine 2 months plus after surgery. So you're 2 months out. You might be 3 months out, 4 months out. It's a good routine that you can follow along with and do.
Yep, a lot of these are similar to the 1 month out or 6 weeks out program. It's just a little more advancements going on here. So.
And if you're a little behind, you don't think you're at the stage, that's fine. You'll catch up.
Yep, check out whatever video in this series relates to you and where you're currently at.
Note, let pain be your guide. Always, number one concern, avoid falling on your new knee, or in most cases, surgeons will say kneeling on it.
Yep, ask your surgeon eventually way down the road if you can kneel on it. They will tell you if you can or cannot. It varies per surgeon and kind of how your knee was and how much surgery you had, if your patella was intact or not, basically.
Sure.
So.
All right, we're going to get into the exercises. I'm just going to, all these exercises, let's start with 1 set of 10, and then you can increase the reps or the sets as you feel comfortable. So.
Yep, if you're already beyond that for sets and reps from before, you can certainly start there. You can do 2 sets. You can do 10 reps, 15 reps, whatever you're comfortable with, just increasing over time how much you do.
Sure.
So.
And these are higher level exercises, so we're really going to get you moving today. So
Yep.
I'll move out the chairs, you get the ball.
All right. Any of these, if you feel unbalanced, certainly hold on to a chair or a walking cane or something. You do not have to do it how we are doing them.
That's right.
So, first one is wall squats. We're going to use a ball. Helps you roll a little more. If you don't have a ball, you don't have to use one.
Yep.
It's just an option. So first, you want to get your legs out a little bit. If they're too close, you're going to squat really awkwardly. So make sure your feet are out. Lean into the ball. It won't go anywhere.
Yep.
And just start doing little squats. If this, like this little bit of motion is all you can do comfortably,
Yep.
then just do that.
Even if it's literally an inch.
Yep.
I mean, that's a start.
If I had surgery on my right leg, make sure to push even with both. Some people will tend to like, if I'm favoring my left side because it's stronger, you could tell they're squatting weird. So even distribution between both.
Yep.
Squat down. You don't have to do a squat like this. You're probably not
Nope.
going to be able to. Okay.
Wouldn't be recommended, I don't think.
If this seems too much to you, put a chair behind you. Do it in a chair first. If you feel uncomfortable with this, you don't have to.
Yep.
Put a walker in front of you. Whatever you need to feel safe. Just if you feel balanced, just do little knee bends. You want to focus on your knee bending. Don't make your knee go forward too much like this. This is wrong.
Yep. Like you're sitting in a
Not
chair.
over your toe. Sit in the chair. So.
Yep. All right. Number 2, I'm going to grab a chair for safety here. This is single leg stance. So I'm just going to start by, I'm going to say my left leg is the affected leg. And I'm just going to stand on the one leg. That's pretty easy at this point.
Camera's over there.
Oh, yeah. That's pretty easy at this point. Then I'm going to let go of the chair, but it's still there in case I lose my balance. And then if that's still easy, then I'm going to close my eyes. And that's probably going to challenge you. Another way to, increase the challenge is to do what we call a tandem stance. I'm going to turn this way. So I'm still holding on to the chair. Actually, this way would be better, wouldn't it?
Yeah,
To
I
see.
would.
All right, so I'm still holding on to the chair. And when you get to the point where you can let go of the chair, go ahead and do so. It's a challenging thing to do, especially after a knee replacement, but it's going to work on your balance.
If these seem easy as well, you can try to stand on a pillow or a foam pad or something.
Sure. There's
So-
always a way to advance. Yep.
Yes, there's always ways to advance this. Number 3 is seated long arc quads. So you could do both legs. This is my surgery leg with the green tape we're saying. This is a cuff weight. It is 3 pounds. You can buy a 1 pounder, 2 pound, 3 pound. You could start without. If your range of motion isn't there yet, don't put weight on.
Yeah, that's the key.
Wait till your motion is all the way there.
Yep.
So I'm going to put this on my ankle. If I am kicking out, I'll show you from a side view so you can see
You want to go
it better.
slow and controlled here.
So I'm going to kick up, hold it for a couple seconds,
Yeah.
go back down.
Slow. Yep.
Don't do this.
Momentum doesn't do anything for you.
Just hold it up, relax, down.
Sure.
Muscles grow and strength comes from time under tension, it's called. So the longer you hold it and the slower you go, the more muscle growth you're going to develop.
Yep.
If you're just whipping through this, you're getting the motion, but you're not really strengthening nearly as much.
Yep.
It makes it a lot more challenging too. If you don't have a weight that's heavy enough or hard enough, hold your leg up there for 10 seconds.
Yep.
Do that 15 times. You're going to feel some burns in your quads. As you
Yep.
can see, my legs are shaking right now.
If you don't have a cuff weight, just hold it for 10, 15 seconds, then it's going to be just like a cuff weight.
So yeah, do what you can. Another option is hamstring curls with a band. Where's my
Yep.
band?
You didn't bring a band?
You didn't bring a band.
Here, I'll get you one.
Go get a band. So if I was at home by myself, I would tie this to a table leg or something, something sturdy you won't move. And all I'm going to do is pull it back. You went right up my leg.
It snaps.
All right, we're just going to pull it back. This type of band is not the best. A TheraBand would be
TheraBand
better.
would work better.
This is a tubing,
Yeah.
but it's working.
But we didn't want to figure out the hamstring, so we had to throw it in there. So
Yeah, so grab a resistance band and work on pulling back as well as kicking out.
Yep. All right. Number 4, we're on to standing exercises. In the last phase of the fitness program, we started these standing exercises. Now we're talking about adding cuff weights. Can I have that, Mike?
Maybe.
So I'm going to throw the cuff weights back on here. And these exercises are going to work every muscle group in your lower body. We're not just focusing on the knee muscles. We're focusing on hips, ankles. So I'm going to start, again, with squats. We already did ball on the wall squats, but these are good to do as well.
These are the ones to put a chair behind you if you feel unsafe.
Yep. At this point, you should feel comfortable not having a chair, but if you need one, better safe than sorry.
Yep.
Then we're going to go hip abduction
So he's kicking
to the
sideways,
side. Stand up tall.
toe straight ahead. Do not externally rotate. You want to show a bad one?
Yep.
That's a bad one. He's rotating his foot out.
And don't use momentum. Nice
Nope.
and slow.
Control it. Control it on the way down, too.
Yep. Okay. And then hip extension. This chair should be a little taller.
Yeah, you had a growth spurt or what?
I think I did.
Did you eat
Puberty.
Did you eat your green beans?
I must have. And then marching in place. And if you get to the point where you don't need the chair, but you want it there, that's great. And then finally, calf raises. And then toe raises.
Yep, so just rocking back and forth. This one's pretty easy for most people unless
Yep.
you have weak calves.
Yep.
But not all of these are directly related to your hip or your
Yep.
knee. Most of them are your hip.
Balance and strengthening. 2 for 1 here.
Next one is lunges. If you are uncomfortable lunging without holding on, you can hold on to a countertop, a chair that is stable. For lunges, lunges are one of the harder ones for people to get the correct motion on.
Yep.
You're probably just going to do partial lunges. So what I'd recommend is getting your back foot back, your surgery leg up front. We're going to switch. You're going to do both. But what you want to do is work on going down. And this might be plenty for you. This
Yep.
will be fine. You don't have to worry about going all the way to the ground. I didn't have knee surgery,
Yep.
so I can go all the way down. But just go down what you can and go up. I would just keep planted like this and try to do your 10 reps.
Sure.
Once your 10 reps are done, I would switch positions
Yep.
because this is going to get a different bending while
Yep.
you're back here. So make sure this is bending.
A lot
Now,
of times it's harder to do this way to get the leg bending behind you than
and
the
what
other.
you want to focus on is using the leg that is in front to do the work.
Yep.
This leg can help. Like I can push with this one, but you want to make this one do most of the work. Whichever one is in front,
Yep.
try to have good posture. Try to look up.
And don't let that knee go past your toe.
Don't go way up front like this. You can see my heels popping up.
Yep.
just go what's comfortable for you.
Sure.
So
All right, lunges.
now,
All right.
step ups.
And I still have the cuff weights on, so we're going to go with it for step-ups here. So we started step-ups in the last phase as well, but now we're going to add step-ups without holding on to something. So you could use stairs at home. You don't even need a handrail at this point. So you're going to
If
step
you
up. If you do,
Use one.
that's fine, yeah. You're going to step up and then down. And you're going to focus on using your quad muscle to step up.
A lot of times you can just leave your leg on there, the one you're focusing on.
Yep.
For this
So it's
exercise.
the right leg.
Yep. So he's just going to leave his right leg up there.
Sure.
Control it on the way down.
Yep.
A lot of people fall back down because they feel a little scared. Definitely.
Yeah, that doesn't do anything for your muscles.
Definitely hold on to the handrails. It's going to help a lot.
Yep.
Try not to pull. Try to use them more for balance.
Yep.
And then
this step is, what would you say, 8 to 10 inches, maybe
Yeah.
even higher. You could start with just a 4-inch step, you know, and
Yep.
work your way up. So,
And-
all right. And then lateral step-ups, a little bit different.
So it just means going sideways.
Yep.
Use rails again if you need. I would do this on both legs, even your non-surgery side. It's good to work both. So he's going to show you from a different perspective. His knee isn't going too far forward again. It's a little different with the lateral way than the forward. He's going to get a lot more of his lateral hip muscles here involved.
Yep. And I'm just touching down and then going back up.
Yep. So don't plop down.
Yep.
Don't fly up. Don't push a lot with your other foot. Try to focus on the one you're exercising.
Again, if you're in doubt, use those handrails, but work towards,
Yep.
you know, not having to use them.
Next one, number 7 is dynamic balance. This is something, if you are really unsteady yet, hold on to a countertop, use a cane, whatever you have available. I will use this walking stick for example during this one.
And I will get out of the way.
First one is sidestepping. So I'm just going to go to the right first. You're going to go sideways. Going to work your hip abductor muscles a bit on each side. A little bit of balance work.
Yeah, and this is functional balance. You do a lot of sidestepping, and he'll get into it walking backwards throughout the day that you don't realize you do.
Yeah, you might not realize it, but if you go in a small bathroom and you're turning around and you're moving to do stuff, like you're going forward, sideways, whatever, around a tight quarters in the bedroom,
Yep.
you have to kind of be able to be versatile.
Yep.
Every patient of ours always says, when am I ever going to do this?
Yeah, I
And
never
we're-
walk backwards. I never sidestep.
You
but-
don't realize you might.
Yeah.
Next one is retro or backwards. So we're just going to walk backwards. Again, hold on.
We're kind of eliminating the vision in this. Vision is a big part of your balance, so you were
Yep, you
eliminating
can't
vision.
see where you're going. Make sure you're on a flat surface when you're doing this.
Yep.
If you need someone there to watch you hold on to a belt, go ahead.
There.
You don't have to give me a snuggie.
ahead.
Come
Come
on. So go backwards. Focus on your knee going straight when you go backwards, too, if that's hard for you yet. So focus on that when you're going backwards.
Yep.
So working on backwards. If you don't need the cane
Yeah.
or anything, don't use it. Last one is marching. So get your marching drums out and start marching along. You can swing your baton around.
And
like
side note, if you're
this.
still using a walker, I mean, don't be concerned. You'll catch up, and a lot of these exercises you can still do with a walker. So.
Yep, do what you can.
All right, number 8, final one, maybe the most important. I don't know, it's debatable. A progressive walking program. I mean, get outside, walk a certain distance one day, next day go a little further. Progressive.
Yep, if you have other health complications, don't feel bad for using like a 4-wheel walker with a seat. Just put the brakes on before you sit on it and rest. Make small increments. Don't be like, I haven't walked at all in like a month and
Yeah.
try to walk a whole mile. Maybe go for a block. Then the next time go for 2 blocks because you're going to be a little sore the next day.
Yep.
Build up over time. Get a walking program going.
If you're limping and you have pain, I mean, you don't want to be walking long distances when you're limping after a knee.
We've seen people that didn't do much and then they decided to go to the store a month later and they're like, I'm
Yeah.
walking around Walmart for 20 minutes and now my leg is killing me today.
They
So
overdid it. Yep.
take it easy, go slow, build up. Don't just go hog wild one day. Just
Yep.
start slow.
Enjoy the exercise routine. What else do you have to say?
Check out bobandbrad.com/programs to watch more videos related to the knee replacement fitness program or any other programs Bob and Brad have done.
All right, thank you.